So for the purpose of the examination, I would start by introducing myself. I would make sure that the lights are dim for this room, for this patient. I'd make sure I have the right patient and the right procedure. I wash my hands, scrub in before I come and talk to this patient and ensure her privacy. So,
Come in.
hello, my name is Eric. I'll be your nurse practitioner today. Is your name Meg?
Yes, it is.
Hi Meg. So here today we're doing a physical examination, is that right?
Correct.
Great. So with this examination, I'll be doing a number of tests that involve listening, palpating, just feeling for a number of things. So if you have any pain or discomfort at any point, you can stop me and we'll stop from there. Okay? So first, I'm going to assess her cranial nerves. So cranial nerve 1 is deferred. It is the olfactory nerve. We're going to start with cranial nerve 2. So at this point, I'll have had our MA do a Snellen visual acuity test on her, both which have revealed that she is 20/20 to both eyes. Next, we'll test for cranial nerves 3, 4, and 6. So I'm going to have you follow this pen, so without moving your head. And this is to move straight towards your nose and back. Look at this pen and look behind me at the clock. Great. Now I'm going to check your eyes. So I'm going to have you look straight at me a couple times. I'm going to shine a light in your eye. Great. So pupils are equal reactive to light and accommodation to both direct and consensual light. So now I'm going to assess for cranial nerves 5 and 7. So I'm going to have you smile for me, raise your eyebrows, puff out your cheeks, and squint your eyes. Great. Now I'm going to test your sensation on your face. So I'm going to have you close your eyes, and I'm going to touch different parts of your face, and you can tell me if you feel it on one side or both sides.
Both.
Great. So now we're test for cranial nerve 8. So first we will palpate the mastoid and the TMJ to make sure that there is no tenderness there. So let me know if there's any tenderness here or here. Great. So next, we're going to test for her hearing. So we'll start with the Weber test. What I'm going to do is I'm going to use this tuning fork. I'm going to set the vibration off on this, and I'm going to put this at the top of your head. Let me know when you can hear the sound, if you hear it equally on one side, on both sides, or on one side more than the other.
Equally.
Okay. So now we'll do the same test for the Rene test, but I'm going to place this tuning fork in the back of your ear on the mastoid, and then in front of your ear. And I'm going to have you tell me when you can stop hearing the sound on both instances.
Stop.
Okay, great. So place that down. I'm going to have you look straight at me and stick out your tongue. Okay. I'm going to have you open your mouth, say ah. Great. And I'm going to have you move your tongue, stick your tongue out, move it side to side. Great. So the uvula rises midline with a soft palate. The tongue is midline. There are no oral lesions noted in the oral cavity at this time. Now we're going to assess for cranial nerve 11, which is your spinal accessory nerve. So I'm going to have you shrug your shoulders. Great. And turn your head side to side, up and down. And I'm going to have you turn your face towards my hand, and the same with this side. Great. Okay. Now I'm going to, so that concludes our cranial nerve assessment. There are no neurological deficits noted at this time. So upon inspection of Meg, she appears well kept, well groomed, skin color is appropriate for her ethnicity. She's in no sign of distress at this time. Her respirations are pretty even and unlabored. She has good posture. Her height is appropriate for her weight, and her clothing is appropriate for this weather at this time. I'm going to inspect her hair, skin, and nails. So looking at her scalp, their hair is evenly distributed. I'm going to palpate for any masses, tenderness, nodules, bumps, or depressions on her skull. Let me know if you have any pain here. So there's none of those above. I'm also going to assess her skin. So looking at her face, there are no abnormal moles or pigmentations. There's no lesions visible. I'm going to assess her fingers. So looking at her hands, the nails are clean and capri feels brisk in less than 3 seconds. there is no clubbing noted to her fingers. So now I'm going to inspect her face. There are no lesions or discharge, redness, swelling noted to her face. The face is symmetrical. And now I'm going to assess her eyes, which show that there are no discharge or lesions swelling around her eyes. I'm going to have you take off your glasses, Meg, and I'm going to palpate the lower lids of your eyes, which reveal that her sclera are anictoric and her conjunctiva are pink and palpable. So now I'm going to palpate your sinuses. You'll feel me touching the top of your head, around your nose, and on your cheekbones. If you have any pain or tenderness, let me know. So frontal, ethmoid, and maxillary. Any pain or discomfort? Great. So after that, we'll inspect her nose. Looking at her nose, there's no obvious lesions, discharge, redness, swelling around her nose. We're going to look inside her nose and do an inspection. Go ahead and lift your head up. Okay, so looking inside the nasal turbinates, there is no obvious swelling. Their nasal septum is not deviated, and there's no discharge noted at this time. Inspecting her mouth, I'm going to have look inside your mouth again. There are no lesions in her oral mucosa. The teeth are intact. There's no missing teeth, and there's no bleeding to her gums at this time. Next, I'm going to inspect her ears. So first, we would start by palpating her mastoid and her TMJ. You can tell me if there's any tenderness here. No? Okay, great. So her auricles appear symmetric and mobile. They're firm and non-tender. There's no swelling or discharge noted. We're going to inspect her ear with the otoscope. I'm going to pull the pin up and back and note that there's minimal cerumen impaction. There's no bulging. Tympanic membrane is pearly gray, shiny. There's no swelling noted inside the ear. Meg can obviously hear my directions clearly, so that is intact as well. So next we're going to examine her neck. I'm going to have Meg tilt her head up, and I'm going to palpate. You can swallow for me. Great. So her trachea is midline. There's no visible thyroid upon inspection. Her neck appears supple. I'm going to take a listen to her neck and listen for any kind of bruit. So normally we would do this on both sides, but for the purpose of the examination, I'm going to do this on her left side. Okay, no carotid bruit noted. Next, I'm going to have you, and the neck appears supple as well. She appears relaxed. I'm going to have you turn to your left side. We're going to inspect her posterior chest. Normally, I would have her disrobe so we can see her backside. Upon inspection, we would see that her posterior chest is free of any lesions, bumps, masses, nodules, any abnormal skin lesions. So after examination, we're going to palpate for tactile fremitus to feel the vibrations throughout her posterior chest. So Meg, I'm going to place my hands up here, and you're going to say 99.
99.
One more time.
99. 99.
Great. So vibrations are equal bilaterally. I'm going to assess for diaphragmatic excursion. So I'm going to have Meg take a deep breath, inhale, and then exhale, and then hold. I'm going to percuss the lung field down the left spine and find the area that is most dull and note that spot there. You can breathe normally, Meg. Okay. And now I'm going to have her take another deep breath again, inhale, and then hold it. And note where the dullness stops. And that distance between those fields is about 4 centimeters, which is normal, and we would normally do that on both sides as well, but I just did the left side. I'm also going to check for her respiratory excursions. So I'm going to place my hands here, Meg, and go ahead and take a deep breath. Okay. Note that the respiratory excursion was about 4 centimeters apart between my thumbs, which is also a normal examination. Okay, so I'm going to listen to her lung fields now with the diaphragm of my stethoscope. Deep breath. Great. So long sounds are clear bilaterally, and there are no adventitious sounds noted at this time. Now I'm going to have Meg turn over. We're going to do the same, but assess her anterior side. So I'll start by checking for tactile fremidus. Go ahead and repeat 99.
99.
Great. So vibrations are equal bilaterally in the anterior chest. We're going to listen to her lungs again with the diaphragm of the stethoscope. And deep breath. Okay, lung sounds are clear bilaterally, and there again is no adventitious breath sounds. So for the cardiovascular examination, we will auscultate by listening to several different points on the heart. The first one is the aortic, which sits at the right sternal border at the second intercostal space. The left sternal border, second intercostal space, is the pulmonic valve, and the third intercostal space to the left sternal border is Earp's point. The fourth intercostal space to the left sternal border is the tricuspid valve, and the last one at the midclavicular line of the fifth intercostal space to the left is the mitral valve, and that you can also palpate there for the PMI, or point of maximal impulse. So I'm going to take a listen now. Okay, so auscultation with the diaphragm reveals that she has normal heart sounds. S1 and S2 are present. I'm going to assess for any murmurs with the bell of the stethoscope on the same points. Okay, so no murmurs noted at this time. Meg has regular heart sounds. So now we're going to have you lay back. We're going to assess for peripheral pulses. So I'll start with the radial pulse on both sides, and then her posterior tibial pulses, and then her dorsalis pedis pulses. Great. Her pulses are regular with a rate of about 70. So now I'm going to palpate her joints from her neck down to her lower extremities. I want you to tell me if you have any pain or discomfort, Meg. Okay, great. So now what I'm going to have Meg do is I'm going to have you squeeze my hands. Nice tight squeeze. Very good. And I'm going to have her bring up her left leg up like that. And then you can flex your knee. Great. And then flex your ankle. Great. Wiggle your toes. Okay. And then I'm going to have you do the same, but on your own, on your right leg. So Meg's exhibiting, we just showed passive and active range of motion. I'm going to take these shoes off for you for a second. I'm going to have you bring your right heel to your left shin and bring it all the way down your leg. Great, and then do it to the opposite. Excellent. So let's have you sit up. Great. So now I'm going to have Meg shrug your shoulders, turn your head side to side, up and down. I'm going to have you bring your arms up just like this, and I'm going to have you push against me, pull against. Now bring your arms up forward like this, like you're about to box, and then pull against me, push against me. Great. You can flex your elbows up and down, flex your wrists. Any pain or tenderness? Mm-hmm. Great. So now we're going to assess for her deep tender reflexes. So we'll start with her radial, just so you can see the radial, and the brachial. I'll have her pull that up, and then her tricep, patellar, and then I'm going to have Meg stand up, and then I'm going to have you put your left knee onto the couch. Great. And this is testing her Achilles. Great. So we would also do this on the left side as well, but for the purpose of this examination, we're just doing it on her right side. I'm going to have to take a seat there. Great. So now I'm going to test for some cerebellar function. I'm going to have you touch the tip of your nose and touch my finger, multiple spots. Great. So now I'm going to have you do rapid alternating movements with your hand on your lap as fast as you can, just like so. Great. So now we're going to test for your sensation. So I'm going to use the same device that we used before. You're going to feel a pinprick sensation and a dull sensation. I'll show you what that feels like. So sharp and then dull. I'm going to have you close your eyes. You're going to feel this in 8 different points, and you can tell me if it's sharp or dull.
Sharp, sharp, dull, sharp, sharp, dull, dull, sharp.
Great. So sensation is intact. We're also going to test for her sense of vibration. So I'm going to use this tuning fork again. I'm going to place this at her lower thumb, wrist area, and then also her toe on both sides. You feel that?
Yes. Yes.
Okay, great. So vibration is intact there. I'm going to have you stand up for me. I'm going to have you close your eyes. So performing a Romberg test, Meg is exhibiting that she has no wavering movements, so she passed the Romberg test. Go ahead and open your eyes. And to test for pronator drift, I'm going to have her do the same thing, closing your eyes, but bring her arms up just like this. Great. So Meg is not swinging. There are no waving motion, so she passed this test as well. So now I'm going to assess your gait. I'm going to have you walk towards me on your tippy toes. Okay, stop, and then walk towards me on heel to toe in a straight line. Okay, and you can turn back and walk straight towards the couch. Great. I'm going to have you bend your spine, reach your toes. So as you can see, there's no spinal curvature. The scapula both rise equally at the same height. You can go ahead and stand up straight, Meg. I'm going to have you turn around again, and then I'm going to have you squat for me. Very good. I'm going to have you walk towards me in a duck walk kind of fashion. Great. You can stand up, turn around. And this is our examination, end of our physical assessment. Thank you, Meg.
Thank you.